Does Mounjaro help with endometriosis? That's a question we're hearing more and more, so let's look at what the evidence actually says. Before we dive in, this video is for general information only and is not a substitute for medical advice. Please speak to your GP or specialist about your own situation. Endometriosis affects around 1 in 10 people of reproductive age in the UK, and finding effective treatment can be a long and frustrating journey. With Mounjaro becoming more widely known, it's completely understandable that people are wondering whether it might help. So what is Mounjaro? Its medical name is tirzepatide, and it's a prescription-only injectable medicine licensed in the UK for 2 specific conditions: type 2 diabetes and weight management in adults with obesity or overweight alongside weight-related health conditions. It works by mimicking 2 naturally occurring hormones, GIP and GLP-1, which help regulate blood sugar and appetite. Now, to answer the question directly, there is currently no clinical evidence supporting the use of Mounjaro for endometriosis. No published clinical trials or peer-reviewed research have looked into this, and the MHRA, NICE, and the Royal College of Obstetricians and Gynecologists have not issued any guidance supporting its use for this condition. It is simply not approved for endometriosis treatment. There is some emerging research exploring connections between metabolic health and endometriosis, and that's a genuinely interesting area of science. But at this stage, that research does not translate into a recommendation to use Mounjaro for endometriosis. We're not there yet. It's also worth understanding that using any medication outside of its licensed indication, what's called off-label use, carries real risks, including unforeseen side effects and potential interactions with treatments already used for endometriosis. That's not a reason to panic if you're on Mounjaro for its license purposes, but it is a reason to be cautious. So what are the established treatments for endometriosis in the UK? Your doctor may discuss options including pain relief such as NSAIDs, hormonal therapies like the combined oral contraceptive pill, progestogens, or the hormonal coil, as well as GnRH analogues, or in some cases, laparoscopic surgery. These are the treatments backed by NICE guidelines and specialist guidance from the ARCOG. If your symptoms aren't well managed, it's worth having an open conversation with your GP or gynecologist, ideally through shared decision-making, about which options might be right for you. If you're already taking Mounjaro for diabetes or weight management, and you also have endometriosis, there are a couple of things worth discussing with your doctor. Mounjaro can reduce the effectiveness of oral contraceptive pills, so if you use the pill as part of your endometriosis management, you should use additional contraception for 4 weeks after starting Mounjaro and after each dose increase. Your doctor can advise on the best approach for your situation. Mounjaro is also not recommended during pregnancy or breastfeeding, so effective contraception is important while taking it. And if you're experiencing symptoms of endometriosis that aren't well controlled, please do speak to your GP. If you're taking Mounjaro and experience severe nausea, vomiting, or are unable to keep fluids down, contact a healthcare professional promptly. To recap, Mounjaro is not approved for endometriosis, and there is currently no clinical evidence supporting its use for this condition. Established treatments recommended by NICE and the ARCOG remain the appropriate first step. Always speak to your GP or specialist. They're best placed to guide you through your options. If you found this helpful, leave a comment below. We'd love to hear your questions. And if you want more straightforward health information like this, give this video a like and subscribe to the Bolt Pharmacy channel.